This is a Sandy Boy Productions podcast.
Welcome to the Urban Pharmacy Podcast, where we help women remove the overwhelm of living their most holistic life. This is the place to find evidence-based nutrition tactics, healthy lifestyle and wellness tips, abundance mindset, and easily implementable low-tox living strategies so you can rise up to your full potential and protect your family's health. I'm your host, Stacey Heine, certified holistic nutritionist and better living advocate. Now, let's get empowered with some simple swaps that make a big impact for optimal wellness. Welcome to episode 15 of the Urban Pharmacy Podcast. Today, I have my friend, Dr. Sung Won, on the episode, and I want you to hear all of the gems that he has to offer. We talk about what ancestors really ate. We talk about his brand called Neogen. We talk about how to find reputable supplements. How does nitric oxide affect our age? Why vitamin B is so important, differences between animal and plant sources of nitrate, the benefits of the elderberry plant, and more. Dr. Sung Won is a dual fellowship trained physician and orthopedic surgeon. He provides the most comprehensive methods of stem cell therapy and regenerative treatments, as well as lifestyle medicine to prevent and reverse chronic disease. Dr. Won is an innovator of stem cell technology for over 12 years for orthopedic and spine conditions. Dr. Won developed the 4 pillars of regenerative medicine and customizes the regenerative treatment for all of his patients. PRP, bone marrow concentrate, growth factors, amniotic, umbilical cord, plasma concentration, and other innovative technologies are utilized to activate and enhance the regenerative treatment. His passion in medicine is utilizing nutrition and lifestyle methods to prevent and reverse chronic disease and optimize health. His research and treatment methods have helped many patients avoid invasive treatments by reversing them through natural means. Let me tell you what, Dr. Won is full of so much good information, and I know that you are going to love this jam-packed episode. Give us a 5-star review if you love it, and let us know what you think by tagging us in Instagram. All right, here we go. Dr. Sung Won. All right, welcome Dr. Sung Won to the Urban Pharmacy Podcast. I'm so excited to have you here. Let's just go right in with the questions. So tell me a little bit about your background and why you got into longevity and lifestyle medicine.
Sure. First, thank you for having me here today. It's lots of fun. I've been practicing orthopedic spine surgeon for nearly 20 years. And also my passion has been stem cell research. But 10 years ago, I lost a dear friend of mine who was in his mid-40s. He was my anesthesiologist, and we worked together almost every single case. I specialize and pioneered in minimally invasive surgery, where we got exposure to a lot of radiation, and unfortunately he passed away with the lung cancer. You know, we used to joke around that because we were experimenting, we used 2 different x-ray machines in the operating room and got great deal of exposure, and we said, hey, someday we'll probably get cancer. And unfortunately lost a dear friend of mine, and then also I started noticing a lot of minimally invasive surgeons developing cancers in their hand as well as their thyroid and other type of cancer. And that got me to start researching about cancer, how to prevent it, because although we joked about it, didn't necessarily want to develop the cancer. And through that journey, found out that so much information that we never learned in medical school about how we can prevent and reverse most of the chronic disease. Learning that most of the cancer is developed by ourselves. It's not something genetic. And that's how I start getting involved with the nutrition and lifestyle modification, longevity medicine, as well as a lifestyle medicine. And realizing that traditional medicine is important, but that is really about management of the disease. We hardly learn anything about prevention, utilizing the nutrition, and then even reversing, and also even beyond that, even optimizing our health. And read through thousands of papers and doing our own research, realized that, hey, we got to change our way. And that's how I really got involved with the longevity and lifestyle medicine.
Wow, what a story. I'm so sorry to hear about your friend. That is super powerful, though, and wow. So it does just show how much our environment has so much to do with our health, and I teach on that, and I know you are a big advocate for plant-based nutrition, and so was that part of your learnings? Is that why you went down the plant-based path, because of all of the evidence that you found behind, disease prevention?
Oh yeah, oh, absolutely. Going through all those scientific papers, because it has to be evidence-based. Before that, I've done all the typical bro science things. I've done the low carb diet to lose weight. You're in med school, so you eat whatever is available. Doing same thing with the residency, and then if it's in front of you and you have 5 minutes, then you eat it. And then over time, you naturally gain weight. So we've done the paleo diet, low carb diet. But that's just basically, we got this information just like everybody else from the internet or YouTube, and not necessarily from the medical school or during the residency, because we never learned it. But during the research, how to prevent cancer, discover so much about the nutritional health, and that comparing keto versus paleo versus Whole30 or whatever that might be, realizing that we got to go back to our roots, and our ancestors really ate mostly whole food plant-based nutrition because that was the only thing that was available, and to really optimize our health for prevention of the disease and reversal and optimization so we can thrive. Realize that the whole food plant-based nutrition was the best, especially for me, but I believe that it is the best type of diet for most people that's out there.
Mm-hmm, mm-hmm. And studies show that from way back in the day, like from fecal testing, like you said, it was mainly fiber. It was mainly fiber that people were consuming. So that is what our bodies are.
Yeah, so they've actually looked at all the studies, like the residues, the studies from the fossils, fecal fossils, and then also looking at the last hunters and gatherers. They were mostly really gatherers and hunters. The women and children gathered, and that was their majority of their food. The guys would go out and maybe once a month would catch something, and then the whole village would eat. And the last the gatherers and hunters are in Tanzania, the Hajads, and when you look at them, they consume about 100 to 150 grams of fiber per day, and then they have no heart disease, no diabetes, no obesities, no cancer, right? And in order to consume that much fiber, you can't eat anything. I mean, they're not vegans, but whenever they catch an animal, they eat the whole thing. However, that is so rare event that 99% of the time, they may not be voluntarily, but because that's all they have, they are pretty much a plant-based. And that's how the ancestors, most of the ancestors really live.
Got it. That is so interesting. Okay, so I want to ask you today about Neogen. Tell me about your partner company that you created.
Yeah. So it was at first. It wasn't just me. It was with the other stem cell physicians and other lifestyle medicine physicians. The way it came about was this. We were doing a lot of stem cell therapy for our patients so that they could avoid surgery, whether it is for spine or whether it is for orthopedics. And one of the most important thing about them is, we would harvest their bone marrow from their iliac crest, and then isolate the stem cells and inject it into whether it's a ligament, a tendons, or into the joint, or even into the disc. But we also needed to optimize their environment so that it becomes successful. Unfortunately, it's not covered by the insurance, and it's a very expensive procedure. And so we spent a great deal of time educating our patients. Just like, patients who had heart attack, we would encourage them to eat about a pound of green leafy vegetables in a day so that they could elevate the nitric oxide in their body. As you know, that by the time we're 40, we lose about 50% of our ability to produce nitric oxide. By the time we're 60, we lose about 85%. And most of the people who need stem cell therapy for orthopedics ranges anywhere from 40 to 75. And so their nitric oxide is so depleted, and it is so important because it's nitric oxide that mobilizes and then also activates our stem cells. And without it, you can put all the stem cells you want, it just won't mobilize and won't do what we're asking them to do. So we needed to optimize their body. But most of these patients, if you have a heart attack, then there's potentially a death coming. They're more motivated. But even then, studies show that most people change their behavior only for about 6 weeks. Okay? And so for orthopedics, a lot of times they said, you know what, I would rather have surgery than change my diet. And so we needed to help them and said, okay, if they won't eat green leafy vegetables or eat mostly plant-centered meals, then we need to come up with a way to help them boost the nitric oxide. So we actually went to the market, and group of us, and looking for the most optimal nitric oxide supplement for our patients. We couldn't find any. Either they were significantly underdosed, they had the wrong ingredients, or they were designed for younger bodybuilders, because a lot of bodybuilders love nitric oxide because they call it nitro pump, because it dilates their blood vessel, and then the bodybuilders wants to show off their veins, and which contains a lot of caffeines and other stimulants and chemicals, which obviously would defeat the purpose of what we're trying to accomplish. So we, out of necessity, we decided, okay, well, let's formulate our own and provide it for our patients. So we had initially no intention whatsoever making it into a supplement company. We only made small portions of it so that our patients could have it as part of their therapy. But once they started taking it, it really helped them with their blood pressure and with all the other benefit that comes with it. They were coming back and say, hey, my blood pressure is down. My, A1C is down. My blood sugar is better regulated. I have more energy, and all the benefits that you would typically see with by boosting the nitric oxide. And once they were done, they said, well, can we still order it from you? Or they said, well, my family members could benefit this. And then we then we started just a shopping cart on our website for our clinics, and then that's how it got evolved. And more people were demanding it. And then we said, okay, well, what if besides the nitric oxide, there are other critical things that most people need, but then the supplement world out there is really not regulated properly. And so can we recommend those to our patients in our clinic setting? We couldn't. And so we said, okay, well, let's try to come up with the ingredients. And then we don't want to be a vitamin company. What we wanted to do is design the products for our patients so that it would really make a difference and make an impact in their health. And that's how the Neogen came about.
I love that. It all starts with, the greater good. So that's amazing. And I feel like Neogen has started in the right place, which is amazing. Can you explain a little bit about how to find a good and reputable supplement? What do we need to look for?
Yeah, first, just like with your food, you got to read the ingredient, and what it says up in the front is mostly marketing. right? And then one has to do some research on their own, right? And just because they said, like vitamin D as an example, it says you need vitamin D, D3, and then it says it on the label up in the front. But how much, right? And everyone has a different need. Not everyone would need, 5,000 IU or 10,000 IU. For most people, because they do spend most of their time inside, they may need 5,000 IU to truly optimize their health. But most commonly, it's at 1,000 or 2,000. It's underdose. So you do need to educate yourself. You do need to get some lab values from your primary care doctors or family physicians. And then you also got to, turn the bottle around, read the label, right? And then do they have a lot of fillers? What are the ingredients in there? Don't just look at the active ingredients. And then also look at if the active ingredients actually has the dose that is going to make an impact. And a lot of times also even probiotics is a perfect example. A lot of times people get that's only about 1 to 2 billion CFU, which really doesn't do much. And a lot of studies show that if it's going to make an impact, it needs to be broad spectrum, and then also needs to be anywhere from 30 to 50 billion CFU. So those are the things that you do need to educate yourself, because there's so many, there's like 78,000 supplement companies just here in the US. And then also you got to know the source, who's developing it, right? If you look at the Facebook or social media, there's a lot of different advertisement, manufacturers encouraging people to start their own a supplement company where they could private label it. And then those individuals may have interest in health and wellness, but they don't necessarily understand anything about making the supplements or the ingredients. They're just repackaging it and reselling it. So know your source. And when we put together scientific advisory board members and other physicians, and they're putting their reputation on the line. They're putting their medical license on the line. And so I think that is a huge difference. And then we are actually utilizing the products in the clinic setting, not as a prescription medicine, but also, a lot of traditional doctors are also practicing somewhat of a, holistic medicine and trying the supplements and nutrition before they go to the medicine. But I really encourage people to know the source, and then also make sure that it is certified by the GMP, it's good manufacturing product. And then also, are they a FDA registered facility? And FDA doesn't regulate the ingredients, and then doesn't make you go through all the testing like a prescription medicine. However, if you're registered, they can come in at any time and inspect the quality process of making the supplements. So those are some of the important things that they do need to know about. Hey, are they FDA registered? Are they certified with the GMP? And then are they getting annual inspections? Do they have the right ingredients, right dosage? And then also who's actually producing those products? Mm-hmm. Because like even some people may have heard, even the GNC, even the Walmart, Target, they've all been fined for carrying the supplements that really didn't even have active ingredients. Okay? Mm-hmm. Because their purpose is different. Their purpose is to sell the supplements for profit. Like in our case, it's a group of physicians that is practicing medicine, along with providing this supplement. So I think we're practicing in a completely different space.
Yeah, for sure you are. And so Neogen got started with Neonox, and I want to go back to nitric oxide a little bit. Can you explain? You explained how our ability to create nitric oxide goes down. But how does it affect our age? Does it really just affect our age because it's helping all systems flow better? Or, how does it really affect the aging process?
Yes. So nitric oxide plays so many different roles in our body. One of the most important is, like you talk about, circulation, because it is produced inside the blood vessel in the endothelium. That's where it gets mostly produced. And then it is the strongest blood vessel dilator. But also it's in the immune system and immune cells also. And nitric oxide actually kills the different pathogens. Also, it is critical for our a central nervous system as well as a peripheral nervous system also, because it is a function also as a neurotransmitter to release certain other neurotransmitters so that the nerve can send the signals much easier and much better. And those are some of the functions of nitric oxide, but it's considered a miracle molecule because there's countless functions of nitric oxide within our system. And then, of course, it plays a very important role in our skin because you have to have a good circulation. It's critical for metabolic process, because without it, your blood sugar elevates, because nitric oxide plays a very important role actually placing the GLUT4 transporter. It's basically like a door that allows the blood sugar to come inside the cell. And when you have a depletion of nitric oxide, the GLUT4 transporter cannot get onto the plasma membrane, the cellular membrane. So essentially, you're not able to place the door on the wall, and then so that the blood sugar will be trapped out in the bloodstream, and therefore your blood sugar is going to elevate. And that is why when you elevate the nitric oxide, people's blood sugar is better regulated, and then also their A1C improves. And those are only very, very few examples of countless functions of nitric oxide.
Amazing. That is super fascinating. And to think, if you don't have that door on the cell wall, and then you also have a lot of saturated fat stuck in the cell, the blood sugar is just never going to stand a chance getting into the cell and doing what it needs to do. So we need nitric oxide, and we need to decrease the saturated fat that we're consuming.
Yeah, you bring up such an important point. Most people think that the diabetes is due to eating a lot of carbohydrates, right? But we know that if you eat the right type of carb, we're not talking about simple, processed, refined carbohydrate. We're talking about complex carb that comes from the whole food. Then you can have it as much as you want because you're so insulin sensitive. But when you are eating a processed food, an animal-based product with a lot of saturated fat and trans fat, all those fat are going to be trapped inside the cell. So it's, and then, in medicine, everything has to be fancy. So we call it intramyocellular lipids, right? And then the fat inside the skeletal muscles, as well as also in the liver cells. Then you have, your cell thinks it has so much energy, you don't need the blood sugar to come inside the cell. And that's one of the most important reasons for elevation of blood sugar and development of insulin resistance and type 2 diabetes. But also it is the lack of nitric oxide, and then also inflammation in our system. And those are the three main factors that I believe is a main source of insulin resistance and type 2 diabetes.
Wow. So, okay, can you explain why vitamin B is in neonax, which is what helps us create the nitric oxide? This is the supplement that, started your guys' Neogen business. Why is vitamin B in there? Why is it so important for us to take it regardless of if we are omnivorous or carnivorous or strictly whole food plant-based?
Yeah. So in US, most people are either 40% have deficiency of vitamin B12, or they're not at the optimal level. We have vitamin B6 and folate, methylated folate, because about 40% of the population cannot activate their folic acid. So it is important. And unless you have a specific test, in my belief is that go ahead and do take the methylated folate. And then also vitamin B12. Those all function as cofactors to the endothelial nitric oxide synthase. It's an enzyme that actually produces the nitric oxide, and that is why the vitamin B6, folate, and B12 are very, very important. Also, the folate, we have it as a methylated because 40% of the population are not able to methylate or activate the folic acid. So it is important for them to actually get the activated folate. And nitric oxide also plays a very important role in the immune system, right? And that's why the B vitamins also play is something that we recommend to make sure that our patients are taking the optimal dose to further boost their immune system, because they also function as a activator or the cofactors of the enzyme that produces the nitric oxide.
Got it. Yeah. So, I mean, I agree with the methylated B. I think that's methylated folate. That was a test that I got done. I know that I have that MTHFR gene mutation, and I can't synthesize unless it, or absorb as well, right? If it's not methylated. So that's good to know. Can you explain the difference between animal-based nitrates and nitrites versus plant forms in regards to nitric oxide production?
Yeah. So the reason why, most people, if they enjoy like the processed food, processed meat, these days, because now whether it's a bacon or other forms of processed meat, we know that World Health Organization has grouped them as a group 1 carcinogen. If you eat enough, you will develop cancer. And one of the reason is because they use nitrite as salt as a preservative, and then it can develop into nitrosamine, which is a carcinogenic agent. And so then now they're using others, and they say it's a nitrate-free processed, bacon or processed meat. But that's not the only reason why processed meat is carcinogenic, because there's also heterocyclic amine, and then also you may develop TMAO in your system, which is a trimethylamine, and that gets oxidized in your liver. But because the nitrate comes with the animal-based product, which is a protein, mostly protein, and then amine, it gets mixed in with the amine and actually develop a nitrosamine. And that's why it goes in the path of developing nitrosamine rather than developing into nitric oxide. And that is a difference. And then also in plant-based, if you get it from the plant-based source, it also has antioxidants, naturally comes from the plant, that it actually steers the nitrate into develop more into nitric oxide rather than going into and development of the nitrosamine. And that is one of the main reasons. So if you get it from the plant source, and also you're not eating it with the animal-based protein, you're less likely to develop nitrosamine. But most important thing is that if you do eat processed food, it's not just the nitrosamine that is carcinogenic. It is also the other agent that you develop, from cooking in a high heat, developing heterocyclic amine, and then also trimethylamine that gets oxidized by the first formed by the bacteria in your gut, and then goes to your liver, and then develops into something called TMAO that increases the inflammation, and which is a strong association with cardiovascular disease. And so I would definitely avoid eating any type of processed meat.
Okay.
Hey friend, before we get too far into this episode, I want to be sure you know about how the environment plays a role on your overall health. For over a decade, I've been learning so much about the lack of health regulation in the personal care and food industries, and that's actually one of the reasons why I started this show. You deserve to know how to protect you and your family from unwanted body burden, and I share further information about how to make better choices and vote with your dollar in our private Facebook community called The Urban Pharmacy. On that note, I want to let you know about one of the easiest ways that we've switched to safer, and that's through my favorite clean beauty brand called Beauty Counter. Your skin is your largest organ, and what you put on it every day matters a lot. And with a low carbon footprint, cruelty-free formulations, and high-performing results, I haven't found a better beauty brand than Beauty Counter in over 5 years of working with this mission-driven brand. To learn more and shop clean, head to mybetterbeauty.com.
And so we can produce nitric oxide with copious amounts of greens, beet greens, right? Arugula is the best source, right?
Yes, pound per pound has the most amount of nitrate.
Okay. But you can also get it by taking Neonox, which is what I really love. I love being able to have something that I can drink. If I know that I'm not going to have room for all the greens that I should be eating that day, like I would favor the mangoes instead. And that's just the way that I live my life. So I really appreciate the convenience of having something that I can drink and still have that nitric oxide in my endothelial cells.
and helping me thrive. So can you explain omegas? Can we go into omegas? Like, we're still sticking with supplements here. Differences in sources that we can get and why optimally we were getting it from a plant source and how that was, introduced. I mean, I'm taking Neomega. Thankfully, I can now keep all of my supplements within one brand, which I really, really love. So now I have my Omega, I have my D, and I have my Neonox and more. So can you explain?
It's actually a great point. So, our body, we do need healthy fat, right? And especially the omegas, and specifically EPA and DHA. But when you hear omega-3, and a lot of people are very familiar with it, and they know that it is good for your heart or cardiovascular system. Their family practitioners may recommend them, but then they always associate that with fish or fish oil. And most people think that omega-3 comes from the fish. Actually, the fish, they don't produce the omega-3. They get the omega-3 by eating microalgae in the ocean. And so you're actually, if you get it from the fish itself, you're getting it from the middleman, not directly from the source that actually produced the omega-3, and then and specifically EPA and then also DHA. But the problem that we have with the fish is that all the studies have shown, and almost every single fish oil that's on the market, and even including the fish itself, are contaminated because our ocean is contaminated. So they contain a lot of different forms of contaminant that tends to negate any benefit that you may get from omega-3. And omega-3 is very important for your central nervous system, so for your brain and your spinal cord development as a fetus and even as a baby, but also even as an adult for brain health, cardiovascular health, and eye health, and then also for immune system and gut health. And so it plays a very, very important role. And then we believe that everyone should, because unless your diet is very diverse, and then also you're getting, especially if you're, whether you're vegan, plant-based or omnivore, paleo, most people are not intaking enough optimal level of omega-3. So we recommend people to optimize their brain health and cardiovascular health to supplement it. But most people are doing it with the fish oil, and then now the studies have shown that it negates any benefit, and so we encourage them to utilize plant-based, microalgae-based omega-3. And then a lot of within the vegan community, they say, well, we can get it from the walnuts, we can get it from the flaxseed. Yes, you can. However, only very small percentage actually gets to become the long chain fatty acid into EPA and DHA. And so you can convert them, but is that enough? And we don't believe that it is the optimal level. So for myself, so that for my brain health and for my cardiovascular health, I definitely supplement, and I supplement with the plant-based omega-3.
Yeah, and most of us are getting too much omega-6, and we're not getting that good balance. So I find it super necessary to take a supplement for sure. What can you tell me a little bit? What you already touched on this, but in terms of probiotics, can you tell me, just go revisit that, and how do people know how to find the right one?
Yeah, and so there's so many different probiotics out there, right? And then whether it is a yogurt or whether it is a drink, and there's so many people that are promoting it. However, in order to be really effective, it has to be very concentrated, and we recommend anywhere from 30 to 50 billion CFU, and then we want it to be broad spectrum. So the Neobiome actually contains 14 different strains, and from the lactobacillus, different strains of it, and then also bifidobacters. And then so it is very important to have a broad base, and then also enough. Because if you look at most of the probiotics, it tends to contain very small, I mean, it sounds like a lot because it says 2 to 5 billion CFU. But in the world of the bacteria, that is extremely small amount. And then also the different medium that the culture is made. And then in ours is a completely plant-based, and so there's no animal-based medium that's utilized to grow and culture the bacteria. And so that's another thing that you want. And whether you're plant-based or not, at least the supplement-wise, you need to get it from the cleanest source, and then you want to try to get it from the plant-based. Just like even vitamin D3, most people don't realize vitamin D3, most common form is an animal-based product. It's not plant-based. And so you want to specifically look for plant-based supplement if you can.
Mm-hmm. That's so interesting. Yeah, I found out recently that the probiotic that I was taking, which I never would have thought, but it was the medium that it was growing in. It was actually like at the stomach of a cow, and I had no idea. So now I know, and now I'm not taking that anymore. So, all right, Dr. Juan, can you explain to me, I don't know if you made this up or where this came from, but your PEARS lifestyle.
Yes. So I like using acronyms to remember things. And then so the PEARS lifestyle is something that it fit the principles of longevity medicine, and even the blue zones like the Dan Buettner's and some of these principles. But I researched a lot of different aspects, and then I try to condense them into an acronym that I could remember. And what I came up with is the PEARS lifestyle. So P stands for plant-based. Whether you're plant-based or not, your majority of your plate should be plant-based. So I tell people, eat more plants, because I have to meet a lot of my patients, halfway. Right? They may not turn 100% plant-based overnight, but I encourage them to fill their plate with as much plants as possible. Okay? And then also moving your body is so critical. So E stands for exercise. It's simply, whether it's 5 minutes or 15 minutes a day, hopefully it's more. It doesn't have to be intensive exercises. So simply just walking briskly, 30 minutes each day will make a significant impact in your health. So that's something that we encourage. As you can't tell right now, but I'm standing on my treadmill. So I have a walking treadmill under my desk. I don't ever sit during the day when I'm working, because I'm in front of the computer screen, and then I'm walking all day long. And so you got to constantly move your body. And then A stands for avoiding toxins. And so it's not just the alcohol or tobacco, but we are surrounded by so many different chemicals, so many different toxins like makeup, as you know very well. And then they have so many ingredients, toxins that, especially in US, that's not even allowed in European countries and Asian countries, but is allowed in this country, or household chemicals or different types of aerosols. Right? And so those are all the things that we want to avoid. And I even consider certain medications to be toxin as well. So if you can treat things without medicine, should be your first goal, right? Using food as medicine and lifestyle as medicine. And R is restore. So there's a lot more things. It's about restoring our mind, our spirit, and our soul, as well as our body. So sleep is one of the most important things in order to restore. Because when you sleep, your brain actually shrinks, and then it's allowed to detoxify. And we need 7 to 9 hours of sleep a night. And then quality of the sleep is just as important as a quantity. And that's something that I struggle with, and I try to work on every single day. And then also management of your stress, no matter how you do it. For me, it is a meditation in the morning, and it's practicing my gratitude and journaling. And those things really help manage my stress, but something that everyone needs to work on. And belonging to a loving community. And that's have shown that it increases the longevity. Having sense of purpose also, because if you have a reason to live, then your body will understand. It will help you live a lot longer as well. And so loving community and sense of purpose is very important. And then finally, S stands for supplement. And there's a lot of different, different opinions, especially even in some of the plant-based physicians. Well, you just got to eat healthy and then you don't need supplements. Well, not everyone can live a perfect life. Okay? It's about progress. It's not about perfection. And then also, I always say, I don't want to be just normal. I want to live well beyond 100 years old, because I just want to see what the world is going to be like in 50 years from now. But then I don't want to be in a wheelchair in nursing home and then losing my memories of people that I care about. And I want to thrive. I want to be like the farmers in Costa Rica, in Ikaria, in Okinawa, who well beyond 100 years old, they're still thriving and they're still working really hard. And then they have their mind and spirit and their body all intact. That's how I want to do it. So if it's going to take taking additional supplements to optimize my body, that's what I would recommend, because that's what I'm going to be doing. So that is my PEARS lifestyle.
I love it. I love it. Acronyms are so nerdy and fun, and I'm trying to create my own, honestly. I love it. So, okay. So speaking of supplements, one last thing on supplements. My husband and I have our company called Green Growers that we have for a few years been making elderberry syrup and DIY elderberry kits. Do you know, or can you touch on the benefits of the Sambuca plant, why elderberry might be really beneficial to consume?
Yeah, I don't know the chemical reasons, but I've actually read a lot of studies where when you take it, preventative measures, that it helps prevent even catching cold, because obviously it helps boost the immune system, but also it has actually helped people reduce the symptoms and then also shorten the symptoms for not just a common cold, but also flu as well. It helps decrease the inflammation. It also functions as an antioxidant, but it is a pretty well known to actually optimize your and boost your immune system. And so that's something that when somebody is looking for a natural means, that is something that I definitely recommend.
Yeah, it's really high up there on the ORAC value for potency and antioxidants. So I find it super fascinating. All right, aside from supplements, can you tell me why you practice cold therapy? I've been watching you. I know that I need to get myself in those cold showers. I feel like I know the benefits, but maybe you can just convince me a little bit more. Why are you doing this cold therapy? Why are you taking cold plunges into your swimming pool in 20 degrees? What is behind all of this Wim Hof crazy cold stuff?
Yeah, so there's it's based on the studies. And there's a lot of not only the physical benefit, but also the mental benefit. But physical benefit wise, it is shown that the cold shower or cold therapy is to decrease the inflammation in your body. Because one of the things that really damages our body is inflammation. So you got to attack it from many different directions. And that's why, like when we practice orthopedics, let's say you sprain an ankle, what do? The first thing you do is put somebody, wrap it in the ice or do a cold therapy. It's not just to reduce the swelling by contracting the blood vessel, but it's also to help decrease inflammation. And so it's something that we should try to do each day. But also when you do a cold therapy on a consistent basis, your body tends to develop more brown fat that actually generates more heat. That means it's going to burn more calories. So it also helps people, develop optimal weight, also improving their metabolic syndrome if they have that. But also we have to get comfortable doing things that is uncomfortable. Okay? And it has shown to really help our develop our willpower and then get us go. But also it's great for skin. And many studies have shown that either cold shower, cold plunges really helps people develop a much better skin as well. And so there's not just the physical, but also a mental benefit. And when I first started doing it, it was hard. And it just the fear of turning on the knob and then getting that cold water. But there's different ways people can do it. People can start out doing a hot shower and then transition into cold shower, and maybe do 30 seconds, and then extend to a minute. And then it gets easier and easier. And then afterwards, it feels so amazing. And sometimes, I like to shock my body. So rather than the cold shower, and then just, jumping into a really, really cold pool, or sometimes I even do ice bath. But when I do that, what I also do is make sure I do breathing techniques before. I mentioned Wim Hof, but sometimes, I do like just meditation and other simple breathing techniques. But what that also does is that decreases inflammation and then also alkalizes your body. That tends to reduce the pain. And then this is one of the things that we also encourage our orthopedic patients to do, the cold shower or cold plunge, because it really does help with their help them manage the pain, not just from the decreasing the inflammation, but also for athletes, it enhances their recovery time as well. But the breathing also tends to, like I mentioned, alkalizing your system. That tends to reduce the pain. So when you actually plunge in, so I do that breathing technique for about 10 minutes. Like if you saw my post on social media, what you didn't see was me laying on the floor and doing the breathing technique before I jumped in. And then once I'm in it, I don't feel anything. And then and after a minute or two, then you start to feel tingling sensation at in your toes and your fingers, and then it's time to perhaps get out. But the breathing technique is also a very important part of doing the cold shower or cold therapy.
Oh gosh, I need to practice what I preach. I teach people all the time to get uncomfortable and get out of their comfort zone. And I mean, that right there, I think is what I need to do, because it's the thing that scares me the most. But you know what? If it's going to give me better skin and prettier hair, I'll go for that. So
yeah,
we'll see what we can get.
Reason.
Okay, so Dr. Juan, where can we find you? Where can we learn more from you and continue following you?
Yes, thank you. People can find me either on Facebook or Instagram at Dr. Juan MD, DRWON and then also occasionally, most of the time, every other week on Mondays at 8 p.m. Central Time, I do a Facebook Live and give a brief information about different topics, and then I answer different questions. So if people want to join, that's when they also can find me. But you can always find me on the Instagram or Facebook. And also if people have any specific health related questions, I welcome them. You can DM me and I'll get back to you. And I personally respond to all the questions people send me.
I love that. So kind of you. Okay, I have one very last question. What does living a holistic life mean to you?
It is, for me, it is about compassion for myself, for my family, for my friends, and for all the ones that I love. And then also, well, beyond that, and the people, the animals, and the planet. And then I think we all live in the harmony with this, universe, and we all have to have, if we have a compassion for them, then they will have a compassion for us. I think then we can develop a much better world, and then also we can live a very, very much healthier life, physically, spiritually, as well as mentally. And for me, that's what the holistic living is all about.
Oh, I love that. Thank you so much, and we will see you soon.
Okay, thank you for the opportunity.
I'm over here cheering you on because you just finished another episode of The Urban Pharmacy. For today's show notes, head on over to theurbanpharmacy.com and be sure to join us inside our private Facebook group called The Urban Pharmacy, where we share inspiration, live trainings, and holistic living tips to help you build community and the healthy lifestyle that you've always wanted. If you enjoyed today's episode, make sure you hit that subscribe button and please consider leaving us a 5-star review. Before we connect again on the next show, follow me on Instagram at The Urban Pharmacy. That's urban with an H and pharmacy with an F. And I can't wait to hear your wellness journey as we get to know each other better. There's truly no better time than now to level up your life, and I am so proud of you for showing up today. Until next time, be well, Health Crusader.